Hi guys, it's Ryan here with Sigma Survival, and today we're going to be talking about how to deal with infections in a survival situation or a post-apocalyptic world or any kind of disaster. So stay tuned, this could save your life. Okay guys, so first things first, if you can, stock up on antibiotics. Now, this here is doxycycline. It is probably the most versatile antibiotic that you can stock. It treats all kinds of things. The main reason why you would want it in a wilderness setting like this is because of Lyme disease. If you get bitten by a tick, you're going to have to take a long course of this to get rid of that. Lyme disease is crippling. You do not want to be without some doxycycline. If you do have doxycycline, it can complicate things though, because you're going to want to have some kind of PPI meds, so proton pump inhibitors, which basically stop the production of acid in the stomach. You can't take this with antacids, it messes it up and you won't get the full effect. So doxycycline guys, stock up on a couple hundred tablets, even 1,000 tablets, because if you've got a family, trust me, you're going to want this stuff. This will treat chest infections, gastrointestinal infections, skin infections, ear infections, all kinds of things. It is like a first line antibiotic. Now, what other antibiotics are useful? We really want to be addressing the top 3 types of infections that lead to sepsis, and they are chest infections, UTIs, urinary tract infections, and skin infections. So, skin infections and chest infections, we've just ticked the box with doxycycline. This might not be enough, however, so then that's where we want to have amoxicillin or penicillin. So these drugs, generally speaking, are like very common in terms of antibiotics. Before I get onto how you can get antibiotics, because here in the UK they're prescription only, it's very difficult, let's talk about UTIs first. So UTIs, more common in women, can be crippling. If it leads to a kidney infection, you're in big trouble. So there is a type of amoxicillin called CLOVE that is like more for kidney infections, I believe. Try and stock up on that if you can. Amoxicillin might do the job, it might not. There is another UTI antibiotic that you can buy over the counter here in the UK. It's called nitro something, I can't remember the name, I'm just going to write it here after I've researched it. Try and stock up on this one, because UTIs are a killer, especially if you're a female. If you're in a disaster type situation and you have to kind of wear the same clothes, or sanitation is poor, you're already malnourished, you're not as hydrated as what you should be, UTIs are going to become a big factor. So having the means to be able to combat that, it's going to be life-saving, okay? So it's very difficult to get antibiotics here in the UK, and probably in some other countries as well. Some countries you can buy them over the counter, but even then they might question what you're going to do with them. So I've got my doxycycline because of malaria prophylaxis. I was going to go on a trip, ended up cancelling it, and ended up with some antibiotics as a result. So you can get a good couple hundred tablets of doxycycline, for a prolonged, couple month long sort of trip abroad. So that's just food for thought. You can buy them online for that as well, or you could go to your doctor and talk to them and say, look, I'm going abroad, I don't want to take malaria meds, I'd rather take doxycycline. And if you tell them it's because you don't want to suffer with traveller's diarrhea as well, you're ticking 2 boxes. So that aside, you can also look into how to grow your own penicillin on things like citrus peels. It's not guaranteed, but it's something that maybe you wouldn't have been able to do before. But if you know how to do that, or you've got some instructionals on how to do that, just stock it now. Because when the pharmacies close and when there's no doctors and no hospitals and you've got an infection, you would give any amount of gold, to save your child that had an infection. But, if you prep now, you'll be better off. Let's talk about when you don't have antibiotics at all, what can we do? So what I've got here in my hands, I do have other versions of this. I have larger versions. So silver dressings, guys, These are great. These would actually work very well as a chest seal as well, or even as like a blister plaster, because they're a bit like a hydrocolloid dressing in the sense that they'll stay on for quite a while. I do have a bit of a problem with the glue on this. It tends to make my skin flare up if I start sweating. So what you could do is just cut the sticky bits away and just leave yourself with the pad that's silver impregnated. If I could only choose one type of bandage or dressing or thing to cover a wound in the field, it would be this, a silver dressing. You can get other types of dressings like alginate dressings or Manuka honey dressings. I think silver's the best bet, I really do. The only thing that will treat burn victims who've got severe burns that are prone to infection is something called silver sulfadiazine, or whatever it's called. I've wrote that down there as well. This is the only thing that will stop infections. Antibiotics will not penetrate the burn site because the eschars, which are the burn scars, will basically have restricted blood supply. So you can give as much penicillin as you want, but generally speaking, you need topical silver. So you could also look into colloidal silver. You could look into making your own. Colloidal gold is also a good alternative that works very similar to penicillin in the way it works. Colloidal copper as well. These colloidal type solutions are very good. Cleaning wounds from the get-go. Now, you've seen this if you've seen my fire methods video. This is just a larger version of an alcohol swab, so you don't have to carry as many. This is great for cleaning wounds if you've got nothing else. It's going to sting and it's going to damage some of the cells on a cellular level, but which might slow the healing process down a bit. But if you've got gunk in your wound, you're going to choose alcohol over nothing else. So the alcohol has to be 70% or more in content, in strength percentage, because otherwise it won't have the maximal effect. So things like whiskey and stuff like that, whilst it might help, generally speaking, it might not be enough. You need isopropyl alcohol. I don't have it on me now, but iodine, I have iodine swabs in certain kits. Iodine is also good, but yet again, that can have a cytotoxic effect. It can damage the cells, and it can sort of cause problems with delaying the healing, but generally speaking, not a massive issue. Let's talk about some herbs. So things that you would find in your kitchen. Garlic supposedly can be used to improve wound healing. It can decrease healing time, which is beneficial, but some cultures use garlic to kill people by putting it on darts or kill their prey. So if it gets into your bloodstream, maybe it could be poisonous, so do your own research on that one. Manuka honey, the only thing I don't like about Manuka honey is that it's full of glyphosate, which is a type of pesticide, because in New Zealand, where it comes from, they use that pesticide a lot. So if you can get some organic, raw, sort of natural honey, don't use it on really young children, because they might be prone to a bacteria that might be living in there that we're not prone to as adults. Honey's great. You can also use sugar. In the American Civil War, they used to put just white sugar on their wounds. The acidity of the sugar impedes the bacteria from growing. But herbs in your kitchen, oregano is probably by far the best one that you could use. It contains something called thymol. I believe that thyme might also have this in as well, just based on the name of it. But oregano in itself is really, really effective. There was a high school student in America that took oregano essential oil, and he essentially found that it was better than amoxicillin at killing different bacterial strains, and they didn't need nearly as much. So imagine you've got an ear infection and you just put a drop of oregano oil or 2 drops of oregano oil in with some olive oil and drop that in your ear. That's probably going to do a really good job and save you a lot of hassle. In China, they also use thymol or oregano oil, and they put it in with the cattle feed, and that keeps the cattle healthy, stops them getting infections. Just useful to know. Essential oils, guys. In my insect repellent video, I talk about eucalyptus oil. you should have some eucalyptus oil in your survival kits. It's like this big. It weighs hardly anything, but there's studies that have shown that eucalyptus essential oil is better than most antibiotics, and it'll even beat the amoxicillin or penicillin resistant antibiotic bacterial strains. Other essential oils that you can consider, lavender. In this country we have something called Sudocrem. I don't know why they call it creme, but it's called that. That's an antiseptic solution cream, and that one of the key ingredients in that is lavender oil. Lavender oil will also give you some pain relief. Clove oil for tooth infections, also antiseptic. Orange oil, so many essential oils that will fight these bacteria. Myrrh essential oil, which has a ton of medicinal uses as well. It even, when my girlfriend's got menstrual cramps, we use myrrh oil, lavender oil and frankincense oil, and it helps massively with pain. Whenever I've got pain, I use that as well. Sandalwood oil was shown to be effective at treating gas gangrene. This is a very serious infection. In the First World War, this was a killer. It's a nasty, nasty infection. I'm going to put all of these studies below, but from a survival context, if you don't have any of these things available, let's look at some of the things that you can do in the wilderness to better prepare yourself and just be better off. Some herbs that you can utilise. So another thing you can do, which is in most first aid kits, is use some disposable gloves like these. If you're handling something, a wound or an infection of some sort, you're cleaning it, use gloves. If you've been out in the wilderness for a while, your hands might be filthy without you even realising it. So just think about this as an option. Personal hygiene, super important. If you don't want to get skin infections, keep yourself clean, as clean as possible. Utilise antiseptic herbs like plantain and yarrow and soak them in water and then use that as a body wash. These are just basic bushcraft type things and herbal medicine type practices that can save your ass. What if you don't have these, or what if you've run out of these? Marigold gloves, this is what we call them here in the UK. Extra wear gloves, cleaning gloves, guys. Now, whilst they're not very good from a first aid context in the sense that you can't have a good feel of what's going on, you can't feel like wet areas, or you can't do fine motor tasks as well. If you're just cleaning a wound out, or if you're applying a herbal salve, wearing some gloves like this that you can then disinfect and clean and leave to dry and then use again, guys, it's a no-brainer. Pack some gloves like this, even for tasks out in the wilderness. I have a few of these in my kit, because if I've got to go to the toilet, I'm going to be using these because I can clean these off after, once I'm done, instead of getting my hands dirty. If I'm bugging out, I might just use disposable gloves, but anyway, enough on that. Other infections that you need to worry about, fungal infections, fluclonazole. You can buy this over the counter. Get yourself some antifungal tablets like these. They're not the first line of treatment, but if you've got severe thrush, especially if you've been using antibiotics for a long period, you're really going to want this, guys. I just thought I'd throw that in there. Things like clotrimazole and sodium bicarbonate solutions, athlete's foot treatment. Keep on top of the fungal infections. And if you do have fungal infections, even bacterial infections, or if you're using antibiotics, try and get some kind of probiotic rich foods or probiotic supplements ready to go. Okay, water poisoning. Now, this is a big one for survival. If you're thirsty, you might end up drinking stuff that you really shouldn't be drinking without purifying it. Now, I have had water poisoning myself when I was in Turkey. It was not pleasant, and imagine trying to communicate with a language barrier to a pharmacist that doesn't want to give you antibiotics, that you need antibiotics. I felt like I was going to die. I was hallucinating by like day 2 or 3 because they wouldn't give me the drugs that I needed. They tried to give me just probiotics. Whilst it is helpful, it's not helpful enough. There's a drug called diafuril that I took at the time. This was a lifesaver. It got me back to health within days. So if you can get some diafuril, get yourself some of that as well. But something like doxycycline will probably do a good job as well. Ozone. Get yourself an ozone generator. This stuff, I believe it's something stupid, like it's 5,000 times more potent than chlorine. at killing pathogens, and you can use it internally. If you overdose on chlorine, it'll kill you. If you drink ozone infused water and you drink too much, nothing's really going to happen. It's just going to oxygenate your body and you're going to be better off for it. Hydrogen peroxide on a wound works in a similar way. It just turns into ozone inside the body, I believe. But ozone for your water, firstly it's going to clean your water, it's going to degrade any sort of pesticides or harsh chemicals that are on your foods if you wash things in that as well. But generally speaking, you know, it's an antibacterial agent, and why wouldn't you want it? So if you're a prepper and you've got the means to get an ozone generator for your water, do get one. Do not breathe it in. It's highly irritating to the lungs and it can really mess you up. We have 2 different ozone generators in our house. I'll put links in the description to both of them where you can get them, see which one you prefer. Both of them work just as well. Honestly, like, I actually feel like since using ozone, even like I feel like my IQ has increased. I know that sounds crazy to say, but I feel so much healthier and more energetic, and I feel like my IQ has increased because it oxygenates your body. Like, you know, oxygen is crucial. Anyway, enough on ozone. Viral infections, guys, you know, there's not a lot you can do, but there are some herbs that can help. Things like echinacea, you know, things like cleavers might help because they can drain the lymphatic system. But you know, keeping yourself healthy and keeping your vitamin levels up and your antioxidants from eating just enough wild edibles that you're not, you know, causing a drastic effect. Because some of these are going to be medicinal, so you don't want to be shutting your kidneys down because you've had too many dandelions, let's say. High dose vitamin C and vitamin D, vitamin E, these are all antioxidants. NAC, N-acetylcysteine, very potent antioxidant. I've seen numerous clinical studies on this where it's good for, even for like traumatic injuries, but an antioxidant is going to help you fight infections, okay? What I will say is that you might want to stock up on things like CLOVE, I believe it's called, for cold sore infections. But basically, I'm going to tell you a personal story now. So I suffer with something called Meniere's disease. It's a horrific health condition. It's not life-threatening, but basically it's an inner ear problem, and one of the root causes of that is potentially the herpes virus, supposedly, and I only found this out recently. So I've started taking something called L-lysine, which is an amino acid, I believe it is, and I'll tell you what, it's better than any pharmaceutical drug you could have. Like, my symptoms were improving massively. So, you know, L-lysine, if you suffer with things like cold sores or herpes, is great. And I believe there are some studies that show that supplementing with L-lysine can also help with things like the common cold, or maybe even things like HPV. But do your own research on it, guys. Ultimately, you need to look at what is best for you. So this is in the middle of a woodland, guys. It's on a bit of a trail. Basically, this is broadleaf plantain, okay? So you can also use narrow leaf plantain. They're both pretty much the same. One's just like narrow and longer. This one is just fatter and shorter. You know, not really much difference. Basically, this is an antiseptic herb. It's probably the most common first aid herb that you want to be utilising. All you need to do is basically just get this and mush it up into a paste. You can do that by chewing on it, and then you just put it on the wound, and you've got yourself an antiseptic herb right there that will stop you from dying of a skin infection and subsequently sepsis. So yeah, great herb in general. Okay guys, another thing that can be used is dandelion. It has some antiseptic properties, so just worth thinking about. Just for topical use on wounds and scratches and whatnot. Okay guys, so moss is another thing that has been used in the field dressings in the First World War. A star moss is naturally antiseptic. In field dressings they would sandwich it between 2 layers of cloth, put it onto a wound, and then because of the pH of the moss, it impedes like bacterial growth. Yeah, so generally speaking guys, moss is a great way of adding like an antiseptic layer. Now, would I choose this over plantain? No, I would always choose plantain, probably as my first line of herbal sort of antiseptic medicines. But, you know, it's nice to know that I can use this, and it's absorbent as well, so it's going to absorb some of that excess blood. Anyway, I hope you liked that video. It did I did try and get as in detail as possible about things. You know, there's no in-depth tutorials necessarily on a lot of the things, but you know, there's a few useful medicinal herbs in the wild that you can use. There's things in your kitchen that you can use. I probably left out things like ginger. You know, that is also quite useful for fighting infections. And there's so many different elements to this topic. If you can stock antibiotics, stock them, but try and limit the use of them. If you can stock things like oregano oil, myrrh essential oil, you know, eucalyptus essential oil, clove oil, all of these things are going to be a lifesaver, and they've got multiple medicinal uses. Silver dressings are the most important thing. And before I forget, because I knew there was one thing that I would forget, in the First and Second World Wars, penicillin wasn't really around until like midway through the Second World War. So what they used to do with the wounds on the British soldiers they would leave the wounds open, and they would a lot of the time they would put like a cast over it, but they would let the flies get to it. Now, by leaving the wound open, that does two things. Firstly, it lets the flies get to it and lets the maggots get to it. Now, this sounds gross, but maggots will help big time. They're going to eat the dead flesh. They're generally quite sterile. It's just, you know, it does freak people out a bit, but it's worthwhile. But by leaving that wound open, but protected by a cast, let's say, you don't trap any infection in with a bandage, firstly. But secondly, you let the oxygen get to it. And when the oxygen can get to it, it means that anaerobic bacteria can't thrive. And anaerobic bacteria is the worst kind. So if you close that wound, you are basically making it airtight, and all of the anaerobic bacteria can thrive, and that is what's more likely going to lead to sepsis. Thanks for sticking with me. I think that I've touched upon quite a few useful things that you can look into. Things like colloidal silver. You know, I've treated tonsillitis on myself, confirmed by a doctor, bacterial tonsillitis, with colloidal silver spray in the back of my throat, and it was gone within 24 hours. I think I used 45 parts per million in a spray form. You have to use it as a spray. It won't work if you gargle it for some reason. That's just an anecdote from me, like that worked. It might not work for everyone, but tonsillitis, bacterial tonsillitis, normally needs like a week of penicillin with side effects. 24 hours of a couple of sprays of colloidal silver and it was gone. So, you know, I'm just trying to give you as many options as possible, because if you're in the wild and you don't have conventional stuff, or even like essential oils or anything else that I've mentioned, at least you can go and pick some plantain or find some moss and use that, you know. Anyway, thanks for sticking with me through the video. I really hope it was useful. Drop me a comment and let me know what you think. Let me know if you want more videos like this. Let me know if I missed anything. Really enjoy making these videos for you guys. I really hope that it can benefit some of you and save some people's lives in the future. Yeah, thanks for watching. Until next time.